Makerere University College of Health Sciences, in partnership with Child Health and Development Center, is researching on the causes for increased vulnerability of communities in Acholi sub-region to acquisition of sexually transmitted infections. Halfway into the research, preliminary findings indicate that 1.6% of the girls aged 13 to 17 years have HIV.
By law, children are individuals aged 13 to 17, not so. And our findings reveal that HIV prevalence in this age group stands at 1.6%. That is probably 2 out of 100 children have HIV based on findings from this study.
The research also reveals that about 47% of families are women-headed, followed by those that are child-headed, translating into a high level of vulnerability of adolescent girls and young women to any social mischief. The reason for many women-headed families is attributed to the protracted Lord's resistance war that paralyzed the region and fractured family structures.
In that period, they lost touch and connection with the center of learning. In our indigenous societies, we all know that learning started from home. So parents were also at a loss about how to raise their children. They were living in confined spaces, sharing in-laws sharing spaces, which was almost a taboo in our normal society.
This, coupled with general low perception, complacency, low adherence, and uptake of drugs, has fueled persistent new infections among adolescent girls and young women.
We stopped communicating about the risk of HIV/AIDS, and people in the public generally feel that they are not at risk of contracting HIV/AIDS. So there has been complacency in trying to prevent HIV/AIDS, and that has tried to almost reverse the gains that we had made.
In the face of the donor fatigue, key sector players are calling for interventions like domestic funding to safeguard some of the gains in the fight. Betty Ochan, the woman member of parliament for Gulu City, who also sits on the Parliamentary Health Committee, assures stakeholders of increased budgetary allocation, especially now that statistics to guide decision-making are available.
We can no longer wait for the final dissemination of this research. We want it very much as yesterday. We also have research work unit in Parliament. We can go and share with them that this research is very important. We want to see how to factor in our other documents, also for budget purpose.
In the meantime, the Prime Minister of Acholi Cultural Institution, Otim Michael, is calling for collaborative efforts geared to reviving culture among communities to catapult decency and good morals.
We need a renaissance, cultural revitalization, or revival for that matter, to change. And this is one area that the cultural institution wants to work with a number of stakeholders, including Makerere College of Health Sciences, that is working in partner with other stakeholders in this research.
All in all, Acholi sub-region is reportedly promising as regards to the 95-95-95 UNAIDS target, as evidenced by the fact that 89% know their HIV status, 73.7% of those are on ART, while 85.6% passed the viral road.